As a vet nurse, it is important to understand how to correctly set up and test an anaesthetic machine prior to use in a patient. In this video, we will be going through this process step by step. Before we get started on setting up and testing our anaesthetic machine, it is important to first check that your patient has been given their pre-medication and is ready to undergo surgery. We will begin by checking the level of oxygen within the tank to ensure it is adequate to last throughout the surgery. To do this, turn the nozzle to the on position and then read the level noted on the tank's gauge. Next, we will check that the oxygen is flowing through the machine by turning on the flow meter, as seen here. We will then check the vaporizer and the levels of anaesthetic agent contained within it. The vaporizer seen within this video uses isoflurane only. The tube seen here is what connects the isoflurane vaporizer to the soda lime canisters. To determine the freshness of your soda lime, perform a visual colour comparison between the soda lime within the canisters and that of the product's original bottle. Last but not least, ensure that the scavenger system is correctly attached to the anaesthetic machine, as this is what will remove carbon dioxide from your patient. Now we are ready to select and attach an appropriate breathing circuit. The weight of your patient will determine which breathing circuit is used. The patient seen here is 15 kilos and therefore a rebreathing circuit has been selected. As you can see, the rebreathing circuit is made up of two tubes. A larger primary tube, seen here on the right, and then a smaller curved tube, seen here on the left. To attach the breathing circuit to the anaesthetic machine, insert the main tube into the inhale input on the soda lime canister and the secondary tube into the exhale input. And lastly, attach a reservoir bag to the soda lime canister based on your patient's weight. Although you don't need to remove the soda lime canister to attach the non-rebreathing circuit, we chose to do so for the purposes of this video. For patients under 10 kilos, a non-rebreathing circuit should be used. As you can see, this circuit is made up of two narrow tubes and then a larger corrugated tube with a reservoir bag attached. Start by securely attaching the scavenger system to the non-rebreathing circuit. Next, attach the circuit to the isoflurane vaporizer. And remember, you must perform a leak test before attaching your patient to the circuit. Begin by occluding the main tube with either your thumb or palm. Next, fill the system with oxygen by pushing the flush button near the flow meter. Now gently squeeze the reservoir bag, ensuring it does not deflate.